The Los Angeles County Department of Health Services announced Sunday, January 10, that it will discontinue the use of COVID-19 PCR tests made by San Dimas-based Curative at pop-up testing sites. The U.S. Food and Drug Administration warned patients and healthcare providers a week ago about the potential risks of false negative results, specifically with Curative's test. The change, which will happen this week, comes after a review of the data that prompted the FDA alert. The Curative tests will be replaced with Fulgent Genetics tests, officials said. Curative provided a limited number of tests at county-supported pop-up testing sites beginning in mid-December. Between December 13 and January 2, a total of 241 Curative tests were administered at there, making up about 10% of all COVID-19 tests administered at county-supported test sites during that time. "We are confident in our data and we are working with the FDA closely on the matter," Curative CEO Fred Turner said last week. "Testing sensitivity and accuracy on behalf of our patients is at the heart of our work. All COVID-19 tests have a risk of false negative results," DHS officials said. That means a person may test negative despite having the disease because the results are sensitive to how well the sample was collected and the concentration of viral RNA in it. While no specific problems with the company's test were identified, the FDA did say the test must be performed in accordance with its labeling and should only be used in symptomatic people within 14 days of symptoms developing. Additionally, the FDA asked that people taking the self-administered test be observed by a healthcare worker. When the test is not performed in accordance with its authorization or as described in the authorized labeling, there is a greater risk that the results of the test may not be accurate, the FDA said in a safety alert Monday, January 4. There is no reliable way to detect early infection, meaning that infection often spreads before symptoms have time to develop, DHS experts said. Nevertheless, PCR tests, including the Curative test, remain better at detecting disease than some other tests, including rapid tests, they added. DHS reminded people to follow public health guidance to protect themselves and others by staying home whenever possible, wearing a face covering over the nose and mouth, avoiding gatherings and frequent hand washing. False negatives can result in infected people unknowingly spreading the coronavirus and further delaying treatment, health officials warn. Those who set up an appointment arrive and self-administer the test by swabbing inside their mouths. Directions are given by on-site staff. Riverside County also has contracts with Curative to perform testing at various sites. Self-administered tests are more prone to false negative results compared to tests administered by a health professional, regardless of the vendor, Riverside County Public Health Officer Drive.